Well, hey guys, welcome back to the weekend vlogs. Today I'm going to be answering some more questions that I got over on my Instagram, and I do have my tree up in the background, although I haven't decorated it yet, and I put my little wintry village up, so excited. I've got a little holiday sweatshirt on that says be merry and bright, super cozy. Last week I did a Dollar Tree shop with me video and a Walmart shop with me video, so I'm going to go back like 2 weeks worth of questions this weekend, so that we really get to dive into them. On the topic of urea and moisturizers, when reading ingredient lists, what is the difference between hydroxyethyl urea and just plain urea? Hydroxyethyl urea is a synthetic derivative of urea. Now, urea, as a side note, is a wonderful, underrated ingredient in skincare products. It's a humectant. It's actually naturally present in your skin as a hygroscopic to help with water content. Applying it to the skin makes for a great moisturizer, but at strengths greater than 10%, urea can actually get in there and dissolve dry, rough, stuck together skin cells. It is a keratolytic at that strength. So it's really good for like dry, rough elbows, dry, rough knees. But hydroxyethyl urea is a synthetic derivative. It's very hydrating, just like urea. For all intents and purposes, they're very similar. But I don't know that hydroxyethyl urea is commonly formulated into products where there is an intended keratolytic effect. Like, I don't typically see it that way. I don't know that it exfoliates to the same extent that high percentages of urea reliably do. Urea is wonderful. If you have dry, rough skin texture in lower percentages, it can also be super effective because anything that improves water content in the outermost layers of the skin, ultimately over time is going to make a difference as far as the buildup of dry, rough skin, because the water content helps the enzymes there do what they need to do to turn over the epidermis efficiently for epidermal maturation. Can I use tretinoin 0.05%, azelaic acid 15%, and then a moisturizer on over at nighttime? So I can't answer if any particular regimen is right for any particular individual, but azelaic acid can be used alongside any ingredient and is commonly prescribed to be used twice a day, morning and evening. As far as how to layer it, tretinoin, then azelaic acid, then tretinoin, it really doesn't matter. And yes, you can put a moisturizer on top of all of that, but honestly, you might find that you don't need to, especially if you've been using tretinoin for a long time, because tretinoin cream, for example, is in a moisturizing base, plus the azelaic acid moisturizing base. You may find that that's adequate. Now, a lot of people ask me about azelaic acid in cosmetic products, which comes at 10% strength. And at those percentage strengths, we don't know how reliable it performs for controlling skin conditions like the prescription strengths do. Azelaic acid is a medication used to treat acne, hyperpigmentation, and rosacea, and it can also be helpful for periorificial dermatitis. The 10% strength found in cosmetics seems to be beneficial for calming down redness, improving just overall skin tone and clarity, and can play a supporting role in your skincare routine for those of you who deal with post-acne marks, for example, discoloration. You know, years ago, azelaic acid, at least here in the United States, was not common in cosmetic skincare products. The Ordinary, I want to say, was like one of the first brands I ever encountered doing azelaic acid in skincare with their azelaic acid suspension. But Korean brands have quite a few great options. This is one from Anua that I commonly recommend, for example. It has azelaic acid, of course, 10%, along with hyaluronic acid, so very moisturizing. I've used this one, it's like another bottle, but I finished one up in the past. It's nice because, at least for me personally, sometimes azelaic acid kind of feels it makes me feel a little itchy, and I've not gotten that with that product. It's a liquid, and therefore it's easy to apply and then apply other things on over without it feeling too heavy. So it's a great option for people who have a more reactive, redness-prone skin. This was an interesting question. Can wrinkles caused by AHA overuse at the corners of my eyes be reversed in any way without getting Botox? Neuromodulators, which include Botox, work to relax dynamic wrinkles. Those are wrinkles that form when the muscles contract. AHAs, like glycolic acid, lactic acid, and mandelic, do not cause dynamic wrinkles. They're caused by facial muscle creasing. What you might be experiencing with AHAs and noticing maybe more wrinkled appearance to the skin is they can be drying if you are are over-exfoliating, for example, with a glycolic acid product, especially around delicate eyelid skin. I call those dehydration wrinkles, and they can be corrected by stopping the use of that and moisturizing the skin. I shared with you guys in last weekend's vlog after we went to Walmart how much I love to use that La Roche-Posay Cicaplast gel around my eyes. I think that's a great option here. HAs, though, actually can improve wrinkles. Higher than 12% strength of lactic acid, for example, can improve the thickness of both the epidermis and the dermis, decreasing wrinkle depth. Kind of irritating around the eyelids, though. I don't recommend using it there. Ammonium lactate is the salt of lactic acid, and you can find that in the amlactin 12% daily. Great option. Very affordable, effective for rough and bumpy skin. That's a great one. But long story short, you wouldn't need to pursue neuromodulator because your skin's a little dry and appearing more wrinkled as a result of over-exfoliating, if that's what's going on. Is it a good approach to do adapalene 3 times a week and tretinoin once a week using on different days? I don't see any reason to do that. Again, can't give anybody any specific advice on what is right for them as far as treatment approach or anything of that sort. There's a lot of discourse online about only using retinoid 3 times a week, only using retinoid, once a week. And that's great when you first start to introduce it slowly to kind of help your skin maybe get a little accustomed to it. But it is a medication that is intended to be used nightly. Now, that being said, tretinoin, after you've been using it for a year, if you're using it just for the anti-aging purposes, you're not actively treating a skin condition with it. The studies show that after doing it daily for a year, you can back down to 1 to 3 times a week and maintain those anti-aging benefits. The study that we have looking at that. So in that case, yeah, it doesn't necessarily have to be used every day. But this specific question asks about doing adapalene some nights of the week and tretinoin other nights of the week. It really doesn't make a lot of sense to do that. I would just go with one and stay consistent with it. And ideally, especially in the case of a skin disease, try and work up to using it every night. Do you think it's appropriate to use CeraVe's 5% hydro-urea lotion prior to applying tretinoin 0.05% cream to the face? Again, disclaimer, I can't say if that's right for any one person, but if tolerated, yeah, urea lotion could be used alongside tretinoin. Urea, like I mentioned at the start of the video, is excellent for moisturizing the skin. Long-term, can help with improving skin texture, water retention. You may find for some people that the combination of tretinoin and urea ends up being maybe a little too irritating, but I don't generally see that happening with urea. It's pretty well tolerated at 5%. So yeah, that as long as that's tolerated, the urea, again, can help with dryness. Great ingredient also to bring in the colder winter months for optimizing water retention in the skin. How often should you moisturize your entire body? Trying to settle an argument. Twice a day after showering only? It is very individualized as far as how often any one person needs to moisturize their entire body. With age, the skin is not as robust, we'll say, at retaining moisture, especially for women as they go through menopause. Their skin tends to become dry easily, and body moisturizing consistently becomes more important. Also, certain underlying skin conditions, dry skin conditions like keratosis pilaris, atopic dermatitis, benefit from daily use of moisturizers for the most part. Whereas other people, they really are like, okay, they could get out of the shower and just pat dry the skin and go about their life and not put a body moisturizer on and be just fine. Some people, again, with drier skin benefit from putting a moisturizer on more than once a day, morning and evening. A reminder though, sunscreen is a moisturizer. For me, I moisturize my entire body at nighttime. I also go through phases where I like to do the soak and smear technique, where you pat dry the skin a little bit of visible drips and you slather on a petroleum jelly based ointment. I'm currently using the CeraVe healing ointment, and then you cover with pajamas to really lock that in the skin and optimize reduction in water loss as you sleep through the night. It's amazing. But then during the day, any exposed skin, because again, I live somewhere where you can wear shorts pretty much all year round, get sunscreen, so that's moisturizing. I also want to point out though that many great moisturizers are notorious for helping to keep the skin moisturized for anywhere from 48 to 72 hours based on their clinical studies. And I find in my personal anecdotal experience, as somebody who's constantly slathering themselves in cream, I find that claim does hold some weight. I have found that to be true with moisturizers that claim that. I do do find that my skin still feels moisturized if I drag it out and don't reapply it the following night, I'm able to keep going with it, that one application, for a couple of days and feel like my skin is still moisturized. So it really varies from person to person. Can I use copper peptides in the same routine with azelaic acid, or is it not advised? Yes, copper peptides can be used along with azelaic acid as tolerated. Does at-home LED therapy actually work? Is it better than microneedling? Yes, at-home LED therapy can work depending on what it is you are looking to work on. Specifically, red and near infrared wavelengths of light can improve collagen production, can help improve inflammation in the skin, reduce redness, and just improve overall skin luminosity, tone, plump the skin, and improve, again, collagen production, so decrease wrinkle depth. Then blue light can target the acne-causing bacteria and be very helpful for acne, especially when combined with red light because it has the anti-inflammatory properties. Now, not all of these devices are created equal. Some of them are cheaply made. Some of them, might overheat because they're not really made well, and that heat on the skin can aggravate conditions like melasma. Also, the blue light in the acne masks can aggravate hyperpigmentation and melasma, but they're actually really effective, especially, if you go with the good one. I, always recommend the Omnilux devices. That's what I use. They're fantastic. They're the ones who make the in-office devices. They put their devices through a lot of safety testing, so that's why I always recommend them over a cheaper device. They are an investment, and I tell people this all the time. They only work if you use them. If you keep them in the drawer and you only use them on a spa night every so often, they're not going to do anything, really. So they have to be used consistently. Same thing with red and near infrared for the scalp, which is something else I use, the iRestore Elite device. Great for improving scalp circulation, improve the cellular metabolism in the follicle, allowing hairs to be in the growing phase, and also helpful for scalp circulation to bring in growth factors to nourish the follicle. It can be very effective for them. As far as how it compares to microneedling, though, in-office microneedling can be a great treatment for a variety of things. Acne scarring, wrinkles. It can be great for age spots, overall skin tone. I mean, there are a lot of benefits for in-office microneedling. At-home microneedling, many of the devices, the needles are really short. They don't elicit collagen induction like the in-office treatments do. And so at best, there may be helping to improve penetration of skincare products, but at worst, they could just irritate your skin. Some devices that people are using at home do penetrate deeply enough. I don't recommend at-home microneedling due to the risk of infection. Even with what the user assumes to be sterile technique, there are still concerns, so I don't recommend it. How long should I wait in between products to apply? Example, my retinol and vitamin C. There's really no need to wait a defined period of time between product application of different products. You can just put them on. The exception is sunscreen. You want to make sure the skin is not wet with product before you apply sunscreen due to concerns that it won't set up properly. Sunscreen should go on a dry face so it sets up properly. If you put it on and there's, damp product there, you are likely in many cases to get pilling of the sunscreen, which is a mess. I have a question about collagen production. We always talk about retinoids, but vitamin C is a necessary cofactor for collagen production. So can retinoids even do their job without vitamin C in the routine? I saw that the vitamin C we get in our diet is not really going to the skin. So absolutely, vitamin C is a very vital component of collagen production. If you are lacking vitamin C, if you have scurvy, tretinoin is not going to be doing you many favors. You're going to have a lot of serious collagen-related issues. And check out my video on the skin signs of scurvy. It is eye-opening, okay? That being said, if you don't have scurvy, you're going to have enough vitamin C in your skin to produce collagen. Now, that being said, topical ascorbic acid, topical vitamin C, if it's formulated well, okay, because ascorbic acid has stability issues and penetration issues that need to be overcome in the formula. But if it's a good formula where the ascorbic acid actually can get into the skin, it's stable and everything like that, then you might get better outcomes with topical ascorbic acid plus tretinoin. Whether or not those benefits are due to ascorbic acid providing vitamin C in the collagen induction step, likely, but ascorbic acid also has some other benefits in the skin, provided, of course, it's a formula where it can get in. Taking vitamin C supplements, however, in an effort to get better collagen production from a topical retinoid isn't evidence-based and likely is not beneficial because taking in supplemental vitamin C mostly ends up in the toilet. It's water soluble. Best to get vitamin C from fruits and vegetables and, a balanced diet. The boring boring stuff. Supplements, you know, they do end up mostly in the toilet as far as vitamin C, and also can harm your kidney. So not without harm there. Can tretinoin, azelaic acid, and ivermectin be used together, or should they be alternated? Yes. Tretinoin is a acne treatment, but it's also used, of course, for anti-aging purposes. I'm assuming this person is speaking about regimen for rosacea, in which case tretinoin, if the individual is able to tolerate it, can actually be helpful for rosacea because it can help cut down on those little papules and pustules, the raised bumps, the little pus bumps. And with long-term consistent use, tretinoin can help improve barrier integrity, which can be a game changer for rosacea because there's some barrier issues going on there as well, which lead to like the heightened sensitivity. Azelaic acid is a rosacea treatment that, like I said, can be used alongside anything and frequently is combined, you know, used alongside, I should say, tretinoin, and it is a rosacea treatment, also beneficial for the dark spots, okay, and for acne. So maybe you're using it for acne, I should say. But the ivermectin, topical ivermectin, Soolantra, can be used with any of these, in both of them, and it is really helpful for rosacea. Likely works by reducing the burden of those little Demodex mites, which do play a role in rosacea. Can't mention Demodex without wanting to itch your face, right? It's like you hear Demodex and it's like a reflex to scratch your face. All right, y'all. So those are the questions I wanted to address in today's vlog. I do want to update you guys though on a little something. So remember a while back in the vlogs, I told you guys I got sucked in at H-E-B and bought this limited edition cinnamon pumpkin pie nourishing body wash. And I was like, oh my gosh, this is amazing. I finished it. 10 out of 10 recommend this. It's a really nice body wash. It leaves the skin clean, but very, very, very moisturized. Like so much so that I was almost like, I'm going to be sneaky and see if I can get away without moisturizing my body. And you know, it was pretty good. All that to say, it's very gentle. The fragrance is lovely. It's not to the point, however, that you get out of the shower and you're like strongly scented from it at all. It just makes for a really nice, pleasant in-shower experience. So I finished it up and I was like, I'm hooked. I'm hooked. Give me more. And what did I add to my cart that came the other day? And I'm happy to report zero regrets on the peppermint bark. Okay, if you like that chocolatey mint, this is lovely. These are really affordable. They're great. I've been super happy. Also, I wanted to update you guys. I am still really happy with this Maybelline Super Stay Teddy Tint. This is the shade Coquettish. I shared this with you guys a while back. And y'all, the longevity of this on the lips is amazing. As somebody who is always sipping on a beverage, this stays on really well, but it doesn't dry out the lips. And it's easy to apply even without a mirror and not have it go all over the place. It doesn't get stringy. It doesn't get goopy. It doesn't get dry and like, I need to put like lip balm on, but it is tenacious. So I have to take the cleansing balm and put it on my lips at the end of the day in order to melt that off. And I'll tell you what does not get it off. Micellar water. Micellar water. Thought it was amazing, right? That's what everybody says. If you know, you know. If you have been here for a while, you know. Micellar water and I were just always like, it doesn't quite work for me. Burns around my eyes. Well, La Roche-Posay gifted me their micellar water, and I've been trying it out because I was like, I've got this big bottle of micellar water that they sent me. I'm gonna give it a go. You know I don't get along with it, but I got other stuff here in my arsenal. So if it doesn't work out, you know, I can supplement with a cleansing balm. And let me tell you, that stuff, first of all, it does have a scent. Second of all, it does burn around the eyes. Now it does a pretty good job taking stuff off of your face, but it will not touch this Teddy tint. Okay, Teddy is not going anywhere. Just the micellar water, rubbing it around and then getting in the shower and trying to rinse it off. No, forget about it. It's staying on there. Wanted to share that with you guys. If you're somebody like me who cannot be bothered with always having to check, do I need to reapply the lipstick? Yeah, it's not going to stay as intensely pigmented all day, but by the end of the day, it still looks like you have lipstick on and doesn't look like, you should probably touch that up. Looks great. Anyway, y'all, come back tomorrow because there will be more Q&A. I hope you guys are having a lovely weekend. And if you like this video, give it a thumbs up, share it with your friends. And as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye.